So this is the package, a complete package supplied with the handheld Doppler L150R. You can see the number. So usually it will be having the model number and also the serial number of the instrument. And we will see what are all the content available in this system. It's a nice padded bag with good packing inside. Foams are inside, so that even if it falls down, nothing will happen to the probe or the instrument. So we will see the component or the list of items. So you will have the Doppler. This is a Doppler L150R, and you have the 8 MHz transducer here, and this white gray color cable actually connects the transducer to the unit, and this is a charger. This unit works on rechargeable battery, and this is a charger for it. And we also supply an ultrasound gel about 250 grams, and then we have a sphygmomanometer dial type for measuring the ankle brachial index. We have a detailed instruction manual. This tells about the procedures, how to measure the ABI and other details. And we also give a complementary software. It's called the ABI calculator. So with that ABI calculator, you can enter the pressure value, and then you will get a nice colorful patient report with hospital name, patient details, doctor name, etc. We will see about this a little later. So all these videos, everything is also available in the CD. So you can go through that video, and then you can also learn how to operate the instrument, how to operate the software. Thank you. Now we are seeing the main unit, and the top of that is the 8 MHz Doppler ultrasound probe. Now see the on-off switch. The switch on the machine, just press it once. On the left side you will see a slide switch, which is the volume control, increasing to push it up to increase, push it down for decreasing the sound. On this right side you have 3 controls, that is the charger point. You can connect the external chargers for charging the battery. The next is the headphone point. You can connect the headphone if you want to hear the sound privately. And this is the connector for connecting the probe cable. So you have to connect one end to this and then another end to the probe. Now very simple to operate. Now you can see the backside sticker, our address, the serial number. To change the battery, just click that tab and pull it, the door will open. Then place the batteries in correct polarity. You have 3 AA size batteries, rechargeable batteries. When you use dry cell, do not charge it, otherwise it will explode. Only when you are using the rechargeable battery you can charge it. Close the door. Now you are connecting with the telephone jack cable to the main unit, and then the other end is connected to the probe side. Very simple. You get a click sound that indicates it is connected properly. You can use any telephone jack for this purpose. Now we are measuring the right brachial pressure. You can see the cuff position. Apply gel. Once you apply gel, then you keep the probe, angle it till you get good sound. Once you get the pulsatile sound, then inflate the cuff. When the pressure is above the systole, the sound stops. Slowly deflate. When the first sound reappear, that the systolic pressure, note it down on a paper. That's the right brachial pressure. So apply the gel on the posterior tibial right side, just below the bone. You can see, keep it in an angle, then you get good sound. Inflate the cuff slowly. Sound stops when you are above the systole. Slowly deflate. When the first sound reappear, that's the posterior tibial pressure on the right side. Without changing the cuff, now you will be measuring the dorsalis pedis. apply gel and then keep the probe, look at the angle, do not move the probe once you get the good sound, adjust the probe till you get good sound. Once you get the good sound, then you can inflate the cuff, stop it once the sound stops, and then slowly deflate. When the first sound reappear, take down the pressure. That's a systolic. Now it's a systolic. So the dorsal speed is right side. Now we will be checking on the left brachial. See the cuff position. You get good sound, good pulsatile arterial flow. Okay. Then you will also be hearing the venous. You can see now we are hearing the venous. Venous is continuous in sound. There is no pulsatile flow. Okay. Once you get the pulsatile arterial pressure, then inflate and then take the pressure and then move the position to the posterior tibial area. Keep the probe, see the location just below the bone, adjust the probe angle, you get good sound. Once you get good sound, then without changing the probe, inflate the cuff, stop when the sound stops, then slowly deflate. When the first sound reappear, that's the left posterior tibial systolic pressure. Very simple to measure. Now, without changing the cuff position, we are measuring at dorsal pedis. Apply gel, then keep the probe, look at the angle, get the sound. Once you get the sound, do not change the probe position. Inflate it till the sound stops, then slowly deflate. When the first sound reappear, that's the systolic pressure of dorsal pedis. Every Doppler machine comes with the software CD. You can place the CD inside your computer tray and install the software as per the instructions. Once the software is installed, this ABI calculator icon is generated. So once you generate this icon, then you can able to record the ABI values and then take a printout. So I am clicking it. Yes, I get the main screen. This is the main screen for ABI calculator. There are few controls here. You can see settings, auto ID, preview, reset and exit. I select settings. So once I select settings, then I get this screen. This screen is for the header. So I can create a letterhead for the hospital here. So I can edit it, I can delete it, I can change it, I can change the font, I can change it to different fonts, whatever fonts, either totally or line by line. I can change it. Now I am changing it to some different font. I can change the color. So now I change the color. This looks very small. So I change this. And this is 2. Okay, I will give one line space. And then I can change the color. I will change it to black. Okay, some dark color. Now it's ready. And you can change the consultant name. You can type in, you can erase it and you can type. Specialist, you can type and change it. Examiner, that means the technician name, you can add it. You can also set logo. If you have a logo either in BMP file format or JPG file format, then you can also bring in the logo inside the header. Now I have our logo in this, so I'll just have a preview. This is how your letterhead would look like. So you will get a line, and then on top of that, whatever you want, you can add. You have the logo, you have the hospital name, you can add your phone number, email, everything you can add. but whatever you add, it should be within these two lines. Now everything is ready. I just say save and exit. I'm coming to the main screen. This is patient ID. Some institutions have their own unique ID for every patient. In such case, you can type in the patient ID. There are some institutions, they don't follow any ID. For them, you can just say auto ID, then the computer generates an ID for them. Then you can select the patient name, the gender, and then age, the consultant, all the details will be there. Now you go to the box. Now if you remember the patient, then his blood pressure for the right side is 140 and the left side is 132, and the posterior tibial right side is 142, left side it was 140, and this side it is 140, and then this is 132 I think. And then once you select, then you get 1.01 and 1. How it is calculated? It is taking highest of the brachial, so 140 is the highest. Okay, for the right side, highest of this 142 and 140, 142 the highest, so 142 divided by 140, so that's the ABI for the right side, 1.01. If you see here, it is 140, here it is 132, so 140 divided by the highest of this 140, so which is equal to 1. So this is the ABI. So as per this, it says automatically normal right arterial study, normal left arterial study. So these are the task 2 guidelines value, and as per this you will get it. To print it, go to preview. Your report is generated. So here the logo, hospital name, patient details, the brachial pressures, and then you get the posterior tibial, dorsal pedis, ABI index, task 2 guidelines, the interpretation, the consultant name. So you just say print, and then if the printer is connected, you will get the print. So that's it. So we have completed the patient. So I just say exit. It's done. Now we are seeing the sample report of the patient, graph with numbers, and then ABI index, guideline, everything is there. How to calculate ABI? ABI, you can see highest systolic pressure of posterior tibial and dorsal pedis divided with the highest systolic pressure of left and right brachial artery. So this is the ankle brachial index. Very simple to calculate. Let's see an example. We see the left side brachial 140, posterior tibial 142, dorsal is 140, right side 132, 140 and 132. And if you take the highest of the brachial is 140, on the left side highest of the posterior tibial dorsal speed is 142, so on the right side it is 140, then it's the ABI. And this is the normal task 2 guidelines value. You can see the normal, mild, moderate and severe, and when the ABI is more than 1.4, that is incompressible arteries. Thank you for watching this video. If you have any doubts, any suggestions, any clarifications, please do contact us on the email and the phone numbers we are given here. We appreciate your comments. Should you need any further assistance, please do contact us. Thank you once again.